This is the most underrated physical exercise of all. In this video, I'll share 12 benefits of jumping rope. Jumping rope can fight and prevent many diseases. I'll tell you which diseases and how long to exercise. How can you start jumping rope? As it's high intensity, you'll need to take precautions. There are also some contraindications. Some people can't do this exercise. I'll explain why. How to trick your brain into doing more exercise for better health. This tip is scientifically proven. Stay till the end for proven ways to get better results. You know, I don't share opinions here, just facts. I only discuss what scientific articles say. This topic on jumping rope was highly requested by you. An activity that can boost your metabolism. Let's start with the benefits, then I'll address other points. The first benefit of jumping rope is lowering blood pressure. Great news for those with high blood pressure. As a physical activity, it builds muscle and improves metabolism. It also helps blood vessels relax better. This contributes to improving your blood pressure. Here's an interesting fact. Most of my high blood pressure patients don't know this. Physical activities can help relax blood vessels. When patients start exercising, blood pressure control improves. It's easier to manage, often reducing need for medication. Of course, diet and other measures are important too. But physical exercise is a fundamental pillar. Jumping rope can really help if you have high blood pressure. It can also prevent high blood pressure, which is great for your health. The second benefit, and why I love jumping rope, is this. It strengthens both abdominal and lower back muscles. With proper technique, you'll contract your abs while jumping. You've probably noticed this if you've ever jumped rope. Strengthening these muscles can reduce pain, especially in the lower back. I have 2 hernias in my lower back, so I need to exercise to improve my muscles. This way, I can stay pain-free without using medication to combat the pain. The first benefit, jumping rope reduces your risk of thrombosis. Have you heard of deep vein thrombosis? When a clot forms in deep veins, it's serious. The clot can break off and travel to your lungs. This is a grave condition called pulmonary embolism, which has a high mortality rate. It's crucial to take steps to reduce your risk of thrombosis. Jumping rope is great for this. It improves your muscles, circulation, and leg strength. These muscles are crucial for improving circulation. So activities like jumping rope are great for boosting circulation. Ever wonder about that? Jumping rope is indeed an excellent exercise for this benefit. Number 4. Jumping rope can improve your cholesterol levels. It can increase good cholesterol known as HDL cholesterol. We know HDL cholesterol protects against cardiovascular disease. The higher it is, the better. You'll have less risk. We know cholesterol is beneficial for our body. What's harmful is excess cholesterol, especially LDL or bad cholesterol. Cholesterol forms hormones, cell membranes, and aids digestion. It's vital for vitamin D, testosterone, and cortisol production. But when cholesterol becomes excessive, that's when you see a rise in cardiovascular diseases. I know there's a lot of debate online about cholesterol. Some experts claim LDL cholesterol isn't linked to these diseases, but scientific studies show a clear connection. So it's crucial to manage your cholesterol by lowering LDL, bad cholesterol, and raising HDL for a better balance. This leads to greater benefits in reducing cardiovascular risk. For HDL cholesterol, we aim for levels above 40 in men and 45 in women. Some studies suggest 45 for everyone, but there's this slight difference. When it comes to LDL cholesterol levels, we need to consider each case individually. Everyone will have a different target value. For instance, a 30-year-old athlete with no history of heart attacks, diabetes, high blood pressure, or smoking. For someone with low risk, an LDL cholesterol of 130 is good. Now consider someone who's had 2 heart attacks, high blood pressure, and diabetes. For this person, our target LDL cholesterol would be 55. So one person's good level is 130, while another's is 55. That's why I can't give a fixed cholesterol value for everyone. It depends on your heart risk. Benefit number 5. Jumping rope helps lower blood sugar levels. For diabetics, which I often mention, jumping rope is an excellent ally. It's a great workout because it boosts metabolism, builds muscle, reduces fat tissue, and improves insulin resistance. So jumping rope can help control diabetes and in some cases, even reverse type 2 diabetes. If you address the root cause, it's often possible to reverse type 2 diabetes with exercise and diet. So jumping rope is incredibly beneficial for your metabolism. And benefit number 6, jumping rope boosts memory, slows dementia, and improves mood, reducing depression risk. It's fascinating how beneficial this activity is. Just look at how beneficial this physical activity is. I really appreciate the memory benefit, like I mentioned, about reducing lower back pain. This memory benefit is very interesting to me too. I always need to be very attentive. As you know, my profession doesn't allow for mistakes. I always need to have a good memory, and physical activity is a way to maintain that good memory. Plus, you can jump rope at home. It's a very easy exercise to do. I'll talk more about contraindications, but here's a positive point. Because often you live far from the gym, you can't go out for a run in the street at night, for example. You can't ride a bike. There are various limitations. I really enjoy working out at home because, for instance, sometimes I get back late at night or early morning from the hospital. And I have 2 young kids at home, so I can't always go out to the gym. So I often exercise at home. And jumping rope is one of my go-tos. It's high intensity and helps with all these issues. And benefit number 7 is that jumping rope helps lower triglycerides. Do you know what triglycerides are? They're a type of fat in our blood, and we use triglycerides as an energy source. When you exercise, you can use these triglycerides as energy for your body. That's why jumping rope helps control triglyceride levels. What's a good triglyceride level? Less than 150? Higher levels are also a risk factor for heart diseases like stroke and heart attack. So, controlling triglycerides is another way to live longer and be healthier. It's also worth noting that when triglycerides are very high, especially over 500 or 1000, yes, this can happen. You're also at risk of pancreas inflammation called acute pancreatitis. This serious condition can lead to various complications. That's why it's crucial to exercise regularly to keep your triglyceride levels in check. Benefit number 8, jumping rope enhances your coordination and improves your posture. I personally experienced a significant improvement in this area. When I started jumping rope, my previously poor coordination improved dramatically. While I've always had good aim in sports, coordination was my weakness. I struggled with maintaining balance. Jumping rope has helped me tremendously in this aspect, so that's another plus point. Benefit 9. Jumping rope can benefit your liver by reducing the risk of fatty liver disease. For those with existing fatty liver, it's crucial to engage in physical activity. Physical activity to improve this condition or stabilize it, preventing your liver from worsening or accumulating more fat, which at certain stages is also crucial. Consider this. Billions of people have fatty liver disease. With simple physical activity, many could improve their condition. Do you have a fatty liver? Let me know in the comments and mention which part of the world you're from. I always like to know. I'm from Porto Alegre. Comment and I'll send you a hug at the end. Benefit number 10, jumping rope and physical activity can reduce cancer risk. Isn't that interesting? Did you know? Recent studies link increased fat tissue and obesity to over 12 types of cancer. Why fat tissue? Now we know it has metabolic activity, producing substances that can cause hormonal changes and increase cancer risk. By improving body composition, reducing fat, and increasing muscle mass. When you add an exercise like jumping rope, you can lower the risk of various cancers, including breast, prostate, colon, and thyroid. Isn't that interesting? Physical activity is really worth it. Benefit 11. Jumping rope can improve bone health by increasing bone density, making them stronger. Fascinating, right? Are you surprised by what you're learning in this video? I'm enjoying making this video too. Researching jump rope benefits has been really interesting. Number 12, also curious. Jumping rope can improve forearm and grip strength in your hands. And why is this important? A study found that people with stronger grip strength, who had larger forearm muscles and a firmer grip, these individuals had reduced risk of various diseases, acting as a protective factor. So, jumping rope also exercises your arms, which is beneficial. Now, who shouldn't jump rope? What are the risks? precautions, duration, and how to start. I'll explain all of this. Let's start with contraindications, mainly for those with heart conditions like atherosclerotic disease. What's that? It's fat buildup in the heart's arteries, the coronaries. If you have any heart issues, consult a doctor first to see if you can exercise. What exercise should they recommend for you? If you feel chest pain during physical activity, that's also a red flag. I suggest talking to your doctor first to determine the best exercise for you. Why can jumping rope be risky for those with heart issues? As it's high intensity, it makes your heart work harder. If you're prone to heart attacks, it could potentially trigger one. Not that jumping rope causes it, mind you. Rope jumping doesn't clog arteries. It can actually prevent that. But those with heart issues should be cautious when starting. This applies to certain cardiac arrhythmias too. Many types are benign arrhythmias, which we call harmless, that don't cause any problems. You can jump rope normally, but it's wise to talk to a doctor before starting any high-intensity physical activity, like jumping rope. This warning applies to other high-intensity activities too, okay? I'm not just talking about jumping rope, but any exercise that will put more demand on your heart. What precautions should you take? Here's an interesting one. Shoes with good shock absorption. This is specifically to prevent joint injuries. When you're starting out, you're not used to the impact. Even with proper technique, this exercise will have some impact. There's no way around it because that's just how the exercise is. So shoes with good cushioning are beneficial and can really help you out. That would be the main precaution to take. How long should you jump rope for? How often and for how many minutes to get the benefits I mentioned? As a high-intensity exercise, it depends on your fitness level. If you're a beginner, besides consulting a trainer, start very slowly. For example, 3 times a week for 1 to 5 minutes each time to help you adapt, because it's more intense and much harder than walking, for instance. So this frequency I mentioned is good for beginners. As your body adapts, you can increase until you reach intermediate level. What's that like? 3 to 5 times a week with exercise sessions lasting about 15 minutes. When I say 15 minutes, it's not continuous. You can do a minute, rest a minute, or do one and rest 90 seconds depending on your fitness level. That would be the intermediate level. For advanced level, those used to high-intensity workouts or running, you can do it 5 times a week, up to 30 minutes to get these cardiovascular benefits. Studies show that 150 minutes of total physical activity per week, split over 3 or more days, not just jump rope, provides these cardiovascular benefits. You'll have 150 minutes of physical activity, not just jumping rope. You can use jump rope as a complementary exercise to help meet this goal, as it's easy to do at home. So, what video are you going to watch next? I suggest you watch a video about metformin. Did you know metformin users need to be careful about their vitamin levels? It can increase your risk of vitamin deficiency. In the metformin video, I discuss its benefits and contraindications. To learn more about the world's most used diabetes drug, just click here to watch the video. Take care. See you next time.